August 2014 marks the 100th anniversary of the start of the First World War. To commemorate this event, the school has put together an exhibition to show how health professionals have worked to improve health in areas of conflict over the past century. We sent writer Lucy Hawking, whose grandfather, Dr. Frank Hawking, was a doctor of tropical medicine at the school, for a sneak preview. She spoke to archivists Claire Frankland and Victoria Cranna to find out what archive materials they'd selected for the exhibition.
We've come up with the title Improving Health in Wartime, and within the archives world there are a lot of exhibitions and other events going on to commemorate the start of the First World War. And when we looked at our collections, at the time we thought we didn't have that much relating to the First World War. Turns out we do have quite a lot of material, but we decided to broaden it out to conflict and wars since the First World War, really to incorporate the contribution that public health professionals and tropical medicine professionals have made to conflicts throughout the 20th century. So we've started with the First World War, but then we have material on the Second World War, and then also current conflicts that staff members have worked through, such as the Balkans conflict and conflicts in the Sudan as well. From my perspective, I've done lots of work on Sir Ronald Ross. So he was the discoverer of the mosquito transmission of malaria and the first Briton to be awarded the Nobel Prize for Medicine in 1902. And he made quite a large contribution to the war effort. So we started with his papers. We have a collection of over 20,000 items relating to him. He was appointed consultant physician to the Indian hospitals in Britain, so this was a surprise to me. So there was Indian troops who came to Britain and were treated in 4 hospitals in the south of England, including the Brighton Pavilion, which was turned into a hospital for Indian soldiers. And one of the nicest pieces that I like is he's writing a letter complaining about the locals staring at the Indians in the hospital grounds, and he wants a fence put up because he thinks that they shouldn't be treated like wild beasts because they've made such a contribution to the war effort. Ross went to Alexandria in Egypt in 1915 and was working on dysentery. So when he was in Alexandria, he found out from him and colleagues later on that they were cleaning kitchen utensils and presumably some surgical utensils in sand. And then it was unsterilised sand, and then they found out there was water so parasites and horrible diseases kind of live in the sand. So he was kind of saying, and then in the collection we have army orders saying only use sterilised sands.
My own grandfather was at the school all his working life. He was a doctor of tropical medicine. His name is Dr. Frank Hawking. Okay. And so we grew up with all sorts of instructions about never eating salad when you go abroad and taking your vitamin B tablets to keep mosquitoes off you. When he heard about the outbreak of the Second World War, he was on the lawn at the British Embassy in Leopoldville, which is now Kinshasa, in what was then Belgian Congo. And he realised that he had specialist expertise as a medic, medical tropical medicine. And so he did a sort of heroic one-man journey all the way back to the UK in order to enlist, thinking he would go back to fight, but then he was redirected because they said he was too valuable. So he went to the laboratories in Mill Hill. Well, certainly my grandfather was a very independent-minded adventurer who didn't want to be told what to do by anybody, and I always thought that was probably one of the reasons why tropical medicine was so appealing to him, because it offered the opportunity to do all this research, to travel, to be quite solitary in his working pattern, but to amass a huge amount of information that he could then come up with that would generate ideas and theories.
We also have stuff from the Second World War, and I'd say that very much carries on being the case, because we have this big collection of nutrition material in the school and in the archives, and a part of that is the internment camps in Singapore and Hong Kong. And somebody who, when he came back, he worked at the school as a lecturer in the nutrition department. He was actually interned in Stanley Camp through the war from 1942 until 1945. And what's amazing is that he, as an internee, he actually continued his research as a nutritionist, because of course he was in this acute centre of malnutrition, and he couldn't stop himself from doing research, and he wrote lots of reports all through his internment about nutritional standards, and we've got some of that in the case. So that's extraordinary. When he left, he wrote lots of papers about the effects of malnutrition on internees. So that's, again,
absolutely
amazing.
extraordinary that he used that as an opportunity to do research on something that would have actually, you could never have organised that experimentally, because you couldn't, I mean, you would never have been allowed to.
And we have photographs of it, of the camp, and so that's, again, you know, this sort of individual-minded, but sort of wanting to help others all the time. And we also have stuff about the school itself in the Second World War, and how the school remained in London all through the war. They were offered to move to Cambridge, but they stayed, and they stopped the general courses, and they ran these 2-week intensive courses again. So, you know, like your grandfather needing to come back and they were determined to stay open, even when, you know, there was bomb damage to the building and things. It stayed open.
So these are some photos, and this shows someone called Lady Mary Simpson, and within the exhibition we've got a small number of letters. So she designed some anti-mosquito headgear in 1917 that she was trying to get the War Office to order, and she writes quite a number of letters to Ross about this and trying to get him to support it.
Are there any responses? Have you got any responses from Ross to her?
There are some responses.
Was he impressed, or was he rather...
He was fairly impressed, but there is one saying that the committee, I'm not sure which committee it was, has decided to go with another sample, but some of her samples will be sent to the front. And then she writes a number of letters saying that the Pasteur Institute has ordered many of her designs of the headgear, and also she name drops quite a lot. So she mentions Colonel Balfour.
She looks like an Edwardian matron in her sort of beautiful hat and feathered jacket.
Yes. So Ross went to Alexandria in 1915, so we have copies of the telegram that asks him to be prepared to embark for service in the Mediterranean in 1915.
I like this. This says, please be prepared to embark for service in Mediterranean on or about Thursday next.
Some of the material which we're currently getting digitised is relating to Arthur Conan Doyle. So he was a correspondent of Ross's, and there's some fascinating material. One really nice piece where Ross is going off to Alexandria and Conan Doyle says something like, Godspeed, please stay safe because the world would not be the same without you on it. Very heartfelt. But then later in 1919, he was very involved in spiritualism and psychic matters, and he urges Ross to spend 1919 looking at psychic matters. And there's quite a curt reply from Ross saying, I do not have time to do this.
We've got a beautiful, really beautiful set of First World War medals here that I gather were awarded to a doctor from the school. I wondered if you could just tell us a bit about some of the medals.
Yeah, so from the school records we found out that the person was called Captain Thomas Spence Dunn. He attended the school in 1908 when he was 47, and this medal here is actually from the Transvaal to say that he was involved in the Boer War. It was awarded to all military personnel and civilians, and evidently war correspondents who were involved in the Boer War in South Africa between 1899 and 1902.
And then we've got these three rather beautiful looking medals here with sort of extraordinary rainbow coloured ribbons and some really quite elaborate designs. Could you tell us a little bit about this trio?
So these three are the medals awarded to people who had fought in the theatre of war in the First World War. The one here on the left, this is the 1914-15 Star, and it's a campaign medal for the British Empire for those who served between 1914 and 1915. They were always awarded as a trio. So the rainbow one is the Victory Medal, and that again was awarded to people who had fought.
So everyone who participated in the Great War would have received one of these medals.
And the War Medal, this one was the campaign medal of the British Empire for service in the First World War, and evidently there were over 6 million forged. Wow. And evidently they were known as Pip, Squeak and Wilfrid, these three medals, by people in general.
We've got a medal here that was not given to 6 million people, though. Could you tell us a little bit about this? So
this is a Distinguished Service Order, the DSO, which is still awarded today for distinguished service by armed forces officers during wartime. over 8,000 were awarded during the First World War, and Captain Dunn's award was announced, like everybody who got the DSO, it was announced in the London Gazette, and the London Gazette's available online, so I checked, and he's mentioned January 1918, and he's listed as serving in the East Africa Medical Service, because when he left the school, he went back to work in Kenya as a medical officer.
It's a fascinating piece of history, especially at the moment when so much focus is on the First World War. It's very interesting to have a look at the other theatres of war, like the East Africa conflict, and think of how people might have been involved in it and in different contexts, like as a doctor. So I think that's fascinating.